r/AskReddit, Autopsy doctors of Reddit. What was the biggest revelation you had to a person's death after you carried out the procedure? Worked at an animal hospital. They did autopsies for zoos all the time. An alligator died, and they shipped it to the hospital, refrigerated etc. to stop the decay. They took it out, and put it up on the table. After doing all the paperwork, they started opening up the alligator. After the first cut, the alligator opened its eyes. Turns out it wasn't dead. The hospital vet mistook an illness for death and the low temperature put it basically into a coma. Edit. Unfortunately, this is all the information I know on this story. It's been 7 years since I worked at that place. I worked at a coroner's office for a while, and once we had a guy who we thought had died from an OD on meth. Well, we started the autopsy and I went to cut his lungs out, and blueberry muffin mix started coming out of them. I stuck my finger in his mouth, and it was full of blueberry muffin mix. And it was in throat. Turns out he got just high enough to pass out while eating the muffin mix, and he ended up choking to death. During my internship rotation a couple of years back, a 40-year-old guy came in because he suddenly collapsed while drinking with friends. He came in unresponsive, mouth bleeding, and not breathing, so we had to intubate him. For some reason, the endotracheal tube, the stiff tube placed inside the trachea to help the patient breathe, won't go in. But we managed to suction copious amounts of blood clots. After CPR, still with unsuccessful intubation, so we had to bag him with a face mask. The patient was declared dead and diagnosed with a ruptured abdominal aortic aneurysm. During the autopsy, they found out that the guy was apparently shot by a gun from the top of the head. The entry wound was obscured by his hair and was barely bleeding at all, and the bullet somehow went through the back of the guy's throat and made a hole behind the base of the tongue, which the endotracheal tube kept slipping into. I did the autopsy of both the robber and his victim. The robber shot the victim in the back when he tried to escape in a motorcycle, and the robber was shot by the police in the exact same situation. What's interesting is that they both died by exactly the same lesion. Both of them had their fourth lumbar vertebra shattered and their aorta, main artery of the body, sectioned at the same level. I thought of it like an extreme example of instant karma. Training in the medical examiner's office. Elderly woman found dead by herself in her home. There was nothing suspicious, so I was given the case. Took out all the organs, dissected everything, completely unremarkable. I cut through the larynx as a last step, before I could clean up and finish the case, and boom. Giant piece of chicken lodged in her windpipe. Not a doctor, but a whole body scientific donation technician. I'm the person who dissects cadavers after they were donated. We very commonly would get young cases, normally overdoses. Had a mid-30s female. Went to medical examiner prior to donation, but they only did an external evaluation. I went to check her genitals to see if I could palpate a uterus. Found a condom full of pills. Similar to most, the body became a crime scene and we couldn't touch her. When we finally were able to continue, they asked us to photograph the pills to send to the examiner's office. They were mostly Advil and Zyrtec. Easily one of the weirdest things I've ever found. My grandmother had a massive stroke in her 30s that paralyzed her entire left side, and died in her 60s from a heart attack. But while doing the autopsy they found out she had bad lung cancer. But she never had any pain from it, because it was in her left lung. She was a very heavy smoker, so it made sense. It's just crazy that she had lung cancer and never knew. This story circulates every year at my medical school. A body came in with a gunshot wound to the chest. There was no exit wound. They tried to locate the bullet during the autopsy. No success. They'd ended a whole scan, X-ray, or CORT, of the upper chest/abdomen/pelvis. No bullet point. At that point someone said fuck it, let's scan the whole body. Lo and behold, the bullet was detected in the popliteal fossa area behind the knee. It had embolized/traveled from the heart all the way down the arterial system to the knee, where it got stuck in one of the narrower blood vessels. When my parents were in medical school they attended an autopsy of a patient who had died in a car accident. Autopsy revealed that apparently this guy had survived a chest shot in Vietnam years ago that the surgeon/medics left in, rather than perform risky surgery. The accident had migrated the bullet to his heart, and was ruled the cause of death. Forensic pathologist here. To come to mind. I had just moved back to my home state where family lives. Get a case with a man with a distinctive last name in the family tree. I put a text out to my mom to see if we were related. But before she texted back I pulled the sheet back and already knew he looked like me. It was my great uncle. Get a case where it's a house fire death. On exam he's got multiple textbook stab and incised wounds. I spent the next 30 minutes getting gaslighted quizzed by PD about "Are you sure?" because they thought this was a straightforward house fire. Unfun fact, fire's not an uncommon way for people to try to conceal a homicide. Sheep farmer. I have to know how to do a necropsy for when something dies to know if it's something that could spread. Had a ewe fall over dead after losing a ton of weight, and after treating her for everything under the sun. She would gasp for air and struggle to breathe, but antibiotics, steroids and anti-inflammatory drugs didn't touch it. She finally passed away, and I cut her open to see what the hell happened, fully expecting to see her lungs riddled with shit. Her heart was 5 times the normal size and hard as a river stone. My guess is she'd had that issue her whole life, and it didn't kill her until she was 2. My wife is a pathologist assistant, and during her schooling carried out the autopsy of a newborn that died minutes after birth. The mother was desperate for a child, and had a history of multiple miscarriages at different terms. This was her first time making it full term, and all prenatal checkups revealed no problems. The delivery was difficult, but successful, and baby was alive for a short time. Skip to autopsy. All signs point to baby being fully developed. Get to the abdominal cavity and the liver is lacerated and hemorrhage everywhere. During the difficult delivery the resident used too much force with a forceps to pull the baby out. The ruptured liver that caused the baby to bleed out internally. Wife was enthusiastic about autopsy up to this point, now has no interest. I was a forensic tech for a state medical examiner's office for about 2 years. I've assisted in about 1,000 autopsies, and have removed bodies from scenes from likely twice that. I told these stories in another AskReddit thread about people who clean up crime scenes. And I have a few takeaways. 1. Man who had a psychotic break, and castrated himself, and stuffed it all into this mouth, before cutting his own throat. 2. Man who was sodomized to death with a broom, a baseball bat, and the tuning end of a guitar. 3. Man who decapitated himself, by hanging himself with high-tension cable, and jumping off a bridge. 4. Woman overdosing whilst carrying an 8-month pregnancy. No really any major revelations like. In terms of something wild unexpected, or a medical finding, that contradicts the police report. Just seen enough shit in one lifetime for 100 people. Edit. You can likely dig through my posts, if you want to find the whole stories. Pretty sure my profile is public. Masters in Forensic Pathology here. You'd be surprised to know the number of people that have life-threatening issues that never went diagnosed, and that they didn't die from. Seen an older guy who died of pneumonia in hospital. On autopsy the guy had both an enlarged heart and a couple of medium-sized aneurysms in the brain. Another guy in his 70s apparently came into the ER, and had chest pain, then died shortly after. Dies of a heart attack, but also had cancer. In less natural circumstances though, saw a guy who had been shot in the head a couple of times. 3 definite entries and a blown out skull, but police only found 1 bullet. Couldn't find the other bullet in his head at all. Assumed the police missed it. Went on as normal with the autopsy, until we got to the chest cavity. The other bullet was just chilling beside his lung. Turns out it entered the skull, hit the inside, ricocheted down his neck, and into the chest. Not a doctor, but I did a necropsy on one of my birds a couple weeks ago. I couldn't tell how she died before it happened, but after opening her up I found about 14 masses of tissue in her reproductive system. At first I thought it was cancer from dissecting one of the masses. Later I found out it was actually an intestinal infection. Edit. It was actually a reproductive tract infection. Some of y'all were asking about the vulture that lives in my backyard, named Randy, so I made r/Randith the vulture. Not mine, but a doctor I used to work with. Back when he was in school, he would do his cadaver labs really late at night, to many people during the day. One time it was really late. Around 2 AM. He was listening to his lecture on his headphones and he saw the cadaver's arm move/twitch. He thought it was just his mind playing tricks on him. Then he saw it again. Proceeded to run away in a panic. He told a few of his classmates what happened but nobody believed him. Next day they had a group cadaver lab with the same cadaver. The arm twitched yet again. The professor did some digging, and it turns out the patient's pacemaker was still fully functional and occasionally fired, causing the arm twitch. He was so relieved. My dad used to perform autopsies. His best story was that they would brought a body that has no real indication of any issues. After examining the body, the only thing of note was that there was blood coming out of the guy's rectum. They begin the autopsy and the guy's organs are completely liquefied, and the body cavity is filled with lead shot. It became apparent really quickly that someone had shoved a shotgun up his ass and pulled the trigger. This was in the 70s, and I still have to wonder what this guy did to piss someone off enough to get a shotgun up his ass. I'm a med student, not a pathologist or coroner. But in anatomy lab the tank next to me had a donor with an inflatable penis pump inside his scrotum and shaft. It was completely self-contained. Fluid in the container in the scrotum could be pumped into the shaft tube creating an erection. Then the fluid would just be released back into the pump and the boner would go away. Pretty wild. I was in charge of making copies of all evidence to be used in the trial of Donald Harvey in 1989. He was known as the Angel of Death. One bit of evidence was an autopsy photo of an exhumed elderly woman. The examiner was holding with tweezers an 18-inch piece of cotton being pulled from her throat. Harvey liked to stuff cotton so far down into the victims' throats that it could not be seen. I still can't shake the image from my brain. Medical student here, and this story is from anatomy class. One of the cadavers in our class died of cancer, and when we took out the gentleman's liver it was very large and full of bumps all over. The liver itself was also hard as a rock. The poor man's cancer had spread all over his liver, and was full of tumors. It really hit home that this was what cancer was like, and demonstrated